How we know that adrenal insufficiency and fatigue is real and not a made-up diagnosis, even though your primary care doc doesn't want to admit it. There are two different diagnoses that fit this. One is called Addison's, one is called Cushing's, and they both have to do with adrenal insufficiency after a point in time. And given that these endocrine disorders are, yes, very real and can be caused by both chemical exposure, viral, autoimmune, and or tumors, I think we need to stop saying that adrenal fatigue isn't real. Why it's relevant. I did a call with someone today that sent me his stuff a couple weeks ago, and as I started looking through his stuff a couple weeks ago, I was like, this is all very interesting. This episode of heat stroke, which is severe adrenal stress, by the way, because you can no longer control your sweating. It's also a vagus nerve response. You can't control your body temperature. You can't control your heart rate. You can't control your blood pressure. Set up a cascade of events, one of which I think was a complete misdiagnosis and a missed diagnosis until several years later. He came in with symptoms of fatigue, weight loss, muscle loss, not being able to control his blood pressure. His symptoms look kind of like POTS, but it's not truly POTS because he doesn't truly have tachycardia. After developing an autoimmune disorder, after developing heat stroke. And even still to this day, he has profuse sweating. So when you read or hear that in his history, you're thinking, oh, I wonder why this guy isn't balancing his salts well, which helps produce antidiuretic hormone, which is produced by the adrenal glands. And then you look at his total testosterone, and a lot of guys would kill for his total testosterone, yet his free testosterone is ranging around like a 20-year-old female. Tired but wired, snacking behaviors, can't get enough salty water, but can't stand plain water. Gets diagnosed with AFib, has his heart shocked in a cardioversion procedure, which can help with AFib, except that he falls back into AFib and 2 years later gets diagnosed with Graves' disease. I don't think this man had true AFib. I think he had Graves' disease brought on by either something going on in the pituitary gland or something going on with his adrenals. And he fits the profile. Like, there are 12 common symptoms of Addison's disease, and he ticks off 10 of them. Incidentally, heat stroke or some other viral or bacterial infection often causes Addison's disease. And I think he was under some kind of adrenal stress before the heat stroke based on him describing his symptoms pre and post heat stroke, when he would literally sweat standing in the shade of a tree doing nothing. And he's, of course, worked with other functional medicine providers near him. He's done the 10X gene test and done some stuff with 10X Health. He's worked with other people, and no one has brought up or tested for aldosterone, DHEA, or done a 24-hour salivary cortisol. No one. His primary complaint is fatigue during the day and a night owl. Second complaint is the inability to build muscle no matter what he does. Anybody who's ever had a client who has used steroids for a prolonged period of time knows that it becomes harder and harder to build muscle because the steroids replace muscle with fatty infiltrate, and we see a significant muscle mass loss. Disorders like Addison's and Cushing's, or adrenal insufficiency, adrenal fatigue, pituitary imbalances, create an abnormal production of steroids in your body. Those steroids mess with your blood sugars, they mess with muscle production, they create fatty infiltrate, and they mess with your ability to sleep normally. I'm sending him back to his endocrinologist for further testing for Addison's, and also imaging of the pituitary gland and the adrenals to make sure that there aren't any tumors present that need to be medically dealt with in order to best serve this client. Because while there are some things in his blood work that we can absolutely clean up, if he has Addison's disease, if he has complete adrenal insufficiency, there's a bigger problem that needs to be addressed. And since this could be the thing that tipped off all of the other health issues, we want to get it under control.